Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a podcast series, Nurturing Bonds Experts' Insights on Breastfeeding. This podcast series aims to educate and support breastfeeding mothers and their families. This year's theme is Closing the Gap Breastfeeding Support for All, which resonates deeply with our mission to provide comprehensive support and awareness for breastfeeding mothers in all their diversity. To celebrate this week, we have with us as our guest Dr. Harsh Desai. Dr. Harsh Desai is director at Obstetrics and Gynecology Department at Sterling Hospital, Gurukul, Ahmedabad. He specializes in obstetric and gynecology and is also known for his expertise in high risk pregnancy care, robotic gynecological surgery, and laparoscopic or minimal invasive gynecological surgery. He's also the first Da Vinci robotic trained and certified gynecological surgeon in Gujarat. Welcome to our show, sir.
Thank you.
Thanks a lot for coming to our platform and giving your time with us, sir. On this occasion, we would like to know that you have extensive experience in obstetric and gynecology, sir. So, what are the most critical benefits of breastfeeding for both mother and child?
Thank you very much for the warm welcome and the platform. I hope this conversation stays informative and your listeners can get a lot of information and benefit out of it. So, to answer your question, I actually don't know where to begin because the whole process of breastfeeding is not just something that is necessary as a nutrition, but it is also necessary on various levels. Say, with regard to the psychological health and well being of the mother and the child, beginning from there, nutrition, immunity, there are so many cost benefits. There is so much of a social advantage. So there are endless advantages to a healthy nursing mother and properly breastfeeding baby. Most important of them, as far as I understand, is the transmission of immune factors. In simple words, the transmission of immunity from the mother to the child. So when the child is born, it's coming into a relatively infected or bacteria and virus laden environment for the first time from where it was in the womb of the mother, where it was safe, warm, and away from all sorts of infections. So, how does the baby fight that infection when encountered for the first time? The breast milk that the mother feeds the child in the first 48 to 72 hours of his life is what we normally know, everybody knows as colostrum. And that is like the, in Hindi, if we say, the Amrut Jal, which sort of transfers the immunity from the mother to the baby. So the baby is ready to face the new environment that he or she is put into.
I think you explained that very well, sir, in a very layman language to our audience, and it is very easy for them to understand the importance of uh, how it is beneficial for a newborn baby, the first breast milk, sir. Also, sir, given your expertise in high risk pregnancies and obstetric emergencies, how do you advise new mothers in such situations to approach breastfeeding? How can they make themselves aware and prepare about this?
So here's my 2 cents on the fact. Uh, when you call something a high risk pregnancy, it is high risk for two reasons. A, the fetus, the baby, is at some sort of risk of either prematurity or being low birth weight or undernourished or growth retarded. There are some developmental defects or at the other end, the reason for high risk is some pathology with the mother. Say she's running high blood pressure, she's got a heart ailment, she's got a liver condition, she's got diabetes. So to each it is different. Uh, but the working principle is, as long as and as early as breastfeeding can be initiated, it is supposed to be. Uh, there aren't many reasons and conditions in which we would want the mother and the child to not be together, not be in the same room and start breastfeeding early. Obviously, if the baby for some reason is to be admitted into a pediatric intensive care unit, even then we would like, as long as possible, to express the breast milk and send it to the neonatal care ICU, where the baby still receives the mother's breast milk. So, I again, for the second time, cannot emphasize enough what the importance of breastfeeding is. It's a topic that if you sit back and think about it, you say every mother does it, but that's actually to me more important job for the mother than protecting the child in the womb for 9 months. I think this is actually carrying more of a burden and more importance in today's day and time, where we see a lot of women who are working, and for whatever reasons they are not able to spend so much of time with the baby, not able to nurse the baby for the first 6 months of his or her life, which you would ideally want to. But even then, today we are in a time where it is possible. There are work environments which are supporting nursing mothers, as well as there are ways and means where the mother can express her breast milk before she goes to work, and then by the time she comes back she can re breastfeed the baby. So breast to me, there are no reasons why a mother should not be breastfeeding a baby. Or rather, I would like to scrutinize any mother who tells me I'm not able to breastfeed my baby as to what the reasons are, and try and sort it out as long as possible. So, in my practice for so many years, very rarely would I have come across a condition where we've been telling the mother, no, it's fine, but then this is something that you cannot do or you won't be able to do.
Yeah, thanks on that, sir. So there, I believe there are some common challenges for the new mothers who they face while breastfeeding. So what observation you have faced that, and can you also tell us and help the other mothers, the new mothers, the expecting mothers, to overcome these issues?
So, while you were asking the question, you probably saw a loud grin on my face, because uh, my commonest problem or challenge is that the mother or the expecting mother, especially for the first timers, they have a picture in their head as to how the whole experience of breastfeeding is going to be like. I'll be this is how it is going to happen, and I'll put the child on my breast, and the child will latch and will suddenly start suckling, and I'll pour humongous amount of breast discharge, and everything will be hunky-dory. It in reality is not. It is a struggle. It is a challenge. It is, and the only thing necessary is patience. You need to, it is your first experience as a mother, saying whoever is the first timer who's trying to breastfeed the fetus, and it is also the first experience for the fetus. So in my experience, I've found they take at least a couple of days before they are proficient or comfortable with the process of breastfeeding. So to all my mothers, I tell them, every time I have a new baby and a mother who's just come out of the delivery ward, do not lose hope, do not lose patience, trust your instincts. uh, in an animal, a calf doesn't need to be taught from where the udders are and where he's supposed to suckle milk from the mother cow, right? It is instinctive. The same applies to humans. All you need is a hungry baby, a comfortable position for the mother, some peace, not a lot of noise around, and patience, loads of patience. And believe me, 2 or 3 days down the line, when the mother is successful, it is like the happiest moment in her life and the most satisfying feeling in our practice. where you see that the mother and child are now one unit, and the baby itself is sustained only on breastfeeding, and the mother is now confident that she'll be able to look after the baby for the coming at least 6 to 9 months of life.
I think so. You summed it this very well. That all that is required is that patience. Whatever challenges and problem comes, you need to have that patience, and everything can be sorted up with that.
Sorry to just cut you off. The problem is, or what I have observed in our young, vibrant mothers is that internet and too much of free flowing information has made them create an image in their head. This is how it is going to be. So there is a discrepancy between the expectation and the reality. They will reach to their expected levels, but not overnight. They will take some time climbing up. And that time is what you need to pass with patience and the trust, the confidence. And you're not an abnormal specimen. You are a
Yeah.
normal human being, and you will be able to go through that phase and reach your ultimate goal. So give more power to all the mothers, and just the message here is keep at it, keep at it. To someone it might be a couple of days, to others it might be 4. There is no time frame big enough, short enough, long enough, shallow enough. Do it and you'll be able to successfully get the experience.
Thanks a lot for that message, sir. Also, moving on to my next question, what role do you believe antenatal and postnatal counseling play in preparing and supporting mothers for successfully breastfeeding? And how is this implemented in your practice? How do you make it in your cases and patients?
So in today's world, you give everybody their fair choice of options. So we do have conversations with our expectant patients who are going through their term of pregnancy as to mm, what are their ideas about breastfeeding. So the first conversation is trying to gather what information they have figured out so far. So they'll give me some information as to what their ideas about breastfeeding are, whether they are in sync with the process of doing it or they are averse to breastfeeding, this, that, and the other. Once they have sort of given out what they believe, is the time where I start talking to them. And if the lady, which is very rare in our urban Indian environment for a girl to be averse to breastfeeding, but generally you start counseling them. You kind of keep telling them what the advantages of breastfeeding are. And here I am, a good 2 decades after my practice, that believe me, I don't remember a single mother who's given me a tough time convincing about breastfeeding. Uh, it's something that is so beautiful. It is even more beautiful than childbirth itself. And to romanticize it would not be scientific, but doing that cardinal sin, I will still say it is the best thing that nature has designed for the well-being of the mother, for the well-being of the child, and for the whole process of bonding. Why would a child love the mother more than a father? Is for no less a reason but breastfeeding.
So, thank you so much for explaining this so beautifully to us and to all our audience who are listening to this. And I don't think even if a mother, in any case, you would have experienced a patient, a mother who is not ready to breastfeed, but your words obviously can motivate her to do this. You explain
We
things
try.
so well, and thank you for that. So, moving on to my last question. Finally, what key message would you like to convey to new and expecting mothers?
Uh, so that's a lot of responsibility on my shoulders to convey a message to all the beautiful and expecting mothers in the world. But like I told you, please breastfeed, breastfeed, breastfeed. Because for the fetus, uh, no amount of external nutrition can supplement or uh, be in lieu of what a breastfeeding can accomplish. It is the most important phase in the child's development. the rate at which the child gains weight in the first year of its life is nothing short of uh, exemplary. If you compare the amount of growth that the child gets in the first year of its life as compared to from the second onwards to say 18 years of his life, this growth spurt is such an important period in its life, from mental development to physical development to immunity to everything, to surprisingly to even their psychological well-being. The difference between a depressed or a soft child versus a active, more aggressive, uh, dynamic child is also what breastfeeding sometimes can accomplish. So it is an integral part, and it is the right of the child. It's not just the responsibility of the mother, but it is the right of the child to be provided with breast milk. There are no contraindications other than that the child is born with some intolerance to the breast milk, something like a galactose intolerance. Other than that, even we promote HIV mothers to breastfeed their child in the phase where COVID was rampant. Mothers were isolated, but we always promoted keep the child with the mother and let the mother breastfeed. It would sound something you know risky to somebody who is a non-medico who probably thinks, okay, so you're putting a baby with a COVID positive patient where we were even allowing the healthiest of adults to go there. Believe me, the protocol worked and they all fed their babies. No babies turned out to be pathologically ill, and it is such a beautiful thing. It is the mother can never do any harm to the child. And if you trust that, breastfeeding becomes an integral part of pregnancy. Pregnancy is not over till you have finished lactation, till you have finished breastfeeding your child for 9 months. So that is like my message. Your pregnancy begins from the point you've conceived and probably ends from the time where you wean your child off breastfeed. It is as important as carrying the baby. Thank you.
Thank you. Thank you so much for sharing your message, experts, and insights with us, sir. And it is with the aim to raise awareness about breastfeeding. And I hope we guys together are doing this. And this message, this conversation is definitely going to help lots and lots of new mothers, expecting mothers, to understand how important is breastfeeding for them and for the child as well. Thanks a
Thank you.
lot for
Thank
coming
you
to the
very much.
platform and sharing. Thanks a lot, sir.